and try it again. Maybe that's what I need to do. Let's see here. Interesting. Okay. Okay, there I am. Okay. Hey, Sandy.
Hey.
Yeah. Good afternoon.
Thanks for clearing up that confusion on my part, Sheila.
Oh, no problem at all, Sandy. Been there, done that. No problem. Good to see everyone. I'm taking names. Some of you I know, others I don't. So if you guys would be kind enough just to put your name, your organization you're representing, and your county and your state, we'll be good to go here in just about 2 minutes. Is that okay with you, Beth?
Yeah, that's perfectly fine.
Okay, and I'll introduce you. I'll be happy to introduce you, and then we can get started. But we'll give them a minute or two.
Sounds good.
Like your red hat today, Regina.
Thank you. I started to be a cat today, but I don't know how people were. That might be a little bit distracting.
That's okay. We're getting closer to Halloween, so I guess we can get away with that, right?
Yeah.
Yeah. Okay, and I am going to just bear with me 1 second, and we'll get started here. Gotta make sure my cat's out of the room. Okay. All right. Well, welcome everyone. I have 12:02 and welcome to the October edition of virtual office hours. My name is Sheila Plogger, and I'm joined here with Regina Knox, our virtual kitty cat.
Hi.
Hi there. I love that. Thank you. That is so cool. Today we'll be talking about a rural FQHC secret to successfully expanding DSME and SMBP blood pressure programs post-COVID. So we have today with us our guest speaker, Beth Stutler. I think that's how you spell your last name. Is it Stutler?
It's Stutler. Yep.
Okay.
Yep.
Okay, good. All right. Beth is a registered dietitian at the EA Hawse Health Center, and she graduated with a Bachelor of Science in chemistry from Davis and Elkins College in 2006. And a Master of Science from WVU in Animal and Nutritional Sciences in 2009. She has a passion for public health, and she loves working in and with her community to help others feel their best. And she currently resides in Petersburg, West Virginia, with her husband, Scott, and her 11-year-old son, Luke. Welcome, Beth, and welcome everyone. And we'll turn it over to Beth, but if you guys would be so kind, if you haven't already done so, just to list your name, your organization that you represent, and your county and state. And Beth, I'll turn it over to you. We'll take our time here. We have an hour today. We'll have, I don't know how you want to do questions, if you want to hold them, or we'll just go as we go with the flow.
I'll just go with the flow. I'm good with questions because if anyone forgets at the end, I'd rather just take them as we go. So,
Okay, all
all
right.
right, I'll go ahead and share my screen. All right, so like Ms. Sheila said, we're going to talk about our success in expanding our diabetes self-management education program and also implementing self-monitoring blood pressure programs after the craziness of COVID, just trying to get the community back out and together. So I'm really excited to share everything that we have done. I get really excited about things. So if I just need to tone it down, somebody just raise their hand and say, hey, Beth, calm down. But I am excited to share a little bit about what we've been doing here at EA Hawse. So I wanted to share a picture of my son, Luke, and my dog, Hercules. They are the lights of my life. I'm telling you, if you've never had a golden doodle, they rule your life. And, but I figured you'd be looking at me long enough that while I gave you a little history about myself, you could see my two favorite things. So I am a West Virginia girl through and through. I was raised in Morgantown, West Virginia. You know, I was a huge WVU fan, but I have a lot of family that went to Marshall because my stepdad grew up in Logan, West Virginia. And my mom grew up in Gallipolis, Ohio, right across the river from Marshall. So we're like a split family. Half of us are WVU and the other half are Marshall. So I don't know, has anybody heard the new song by Huey Mack that just was released with Brad Paisley called Dear West Virginia? Did anyone hear that song yet?
I have not, but I love Brad Paisley, and I know he's from, is he from Morgantown? Is it Morgantown?
Wheeling. Yeah.
Wheeling. Okay. Yeah. Yeah.
So one of our chiropractor here actually sent it to me yesterday, and I was like, oh, I wish I could have like a clip to play for y'all because it just, it was just a great depiction of West Virginia and why people love it here. And yeah, it's about community. So if you ever have a chance, look up on YouTube, Dear West Virginia with Brad Paisley. It's definitely worth it. But
thank you.
Yeah. Like I said, I grew up in Morgantown. I just knew in high school I was going to move far, far away from West Virginia. I was not staying here, but I ended up clear in Elkins, West Virginia, which is only an hour from Morgantown. Loved it there. Went on to get my chemistry degree. Fell in love with biochem, and that's what led me to nutrition. Went to WVU, was just going to do food science, but then I met Dr. Cindy Fitch. And she was so captivating. I loved her life story. She works for WVU Extension now. And it changed into, I fell in love with community nutrition and I just knew I had to do that. So my parents were thrilled. I added an extra year at WVU, but I became a dietitian. So that's how I got there. And so now, any questions about being a dietitian there? So I work for EA Hawse, and it's based out of Baker, West Virginia. I'm not sure if anybody is really familiar. We are in the Eastern Panhandle. I like to call it the armpit of West Virginia, just because of how the hands are. It's beautiful here. The first EA Hawse Center was opened in 1981 in Baker, and it just did primary and behavioral health as well as like dental services, which was really good for our area because this is before the quarter H was built. So it took a long time to get to, even if you needed to get to WVU, it was quite a haul to get over the mountain. Even Winchester was a haul at one time to get to. So this was really great for them to be able to be in our community to provide such great care. It now has an on-site pharmacy and x-rays as well. So that's been helpful. It has expanded over the years. We now have 6 facilities. So you'll get to see all the pictures here. But in 2021, they acquired another medical center, Hahn Medical, which increased it to an additional 3. So we are all over Grant and Hardy County and even Hampshire County now. So these are our facilities. They all have beautiful landscape in Matthias. It's really neat there. And then our Wardensville office as well. It's a really cute community. And then I personally, my main office is at Grove Street Medical Center or Health Center. It's in Petersburg, West Virginia, just 2 streets from my house. So it's nice. But we also have behavioral health, dental services, an on-site pharmacy. And this is where we originally started dietetic services, and also diabetic education classes. Then Hardy County Medical is in Moorfield, and they just do primary care, but they also have an evening clinic to help with people that work during the day that need to be seen at night. And they just started that, and that has blossomed. And then we also have our Romney Medical, which is in Romney, West Virginia, and they just do primary and behavioral health as well. So you can see we are all over. So expanding was definitely needed, especially when, you know, it takes almost an hour to get from Matthias clear to Grove Street. You're not going to get very many people that want to do that often, especially with the price of gas and even terrain, and then the snow in the area too. So now I want to just talk about the programs we have started. This is Sandy Ford. She is our diabetic educator. She is also a pharmacist. She told me she has over 15 years experience teaching these classes. Just a little about the classes. The last year's data showed a decrease of 1.06% in the A1C. So she was really excited about that. She came to Grove Street in 2019, and classes were held here only. And excuse me, with the help of Marshall University, we were able to expand to Baker and to Moorfield offices. This has really increased people coming here and attending the classes and seeing her. I also found that patients will come if they're familiar with the area. So if they live in Wardensville, Romney, or Matthias, and they don't know anything about Petersburg, they're pretty much not going to show up for their appointment because they're probably scared, even down to the parking site. Where are they going to park? Where they're going to go? Where the office is? But now that she's right there where they see their regular provider, it has really increased participation. So that's been really nice to be able to provide that. Okay. And then we also have our pharmacy program, which we have paired with, of course, the pharmacy, and then Farmers Market Association and West Virginia Extension. But we get a lot of our diabetic patients and hypertension. Tons of them got in that were referred into our programs, attended our pharmacy this year. So I definitely wanted to include that. We were able to provide lots of people with blood pressure monitors to take home. I always had one laid out. We started pharmacy in 2021, and we only had 2 sites, and that was in our Baker location and Petersburg location. We started with 30. I think we ended with like 18 people that finished the first year, which I was excited about, being the first year and getting it all started. But this year, we went to 60 participants in 3 sites. So that was a big, big jump. And we ended up with about 45 completing, which I was really excited about. I'm going to share some pictures here. This was one of the pictures of our produce that one of the farmers brought in. He always had beautiful color. Both farmers that worked with us had beautiful colored vegetables almost every week. Vicki Fertig, who works with WVU Food and Nutrition Program, always included a fun activity. Everyone might not have wanted to participate, but they did. It was such a great time. There was even one little girl that once she started school, she actually switched to our evening pharmacy location, made her grandmother switch to the evening pharmacy location so she could continue to come, and mainly was to do these activities. This is an inside setup. Most of the time we were outside, but weather, sometimes caught us in, but it was a really pretty easy setup for everybody. And then this was outside our Hardy County Medical in Moorfield, how we had it set up. And I wanted to include this picture because this is our participants cutting up watermelon. And the tall guy there, he confessed to me that was the first time he had ever cut his own watermelon, and he never would buy watermelon because he didn't even know how to cut it. So he really learned something that day. He was all excited, but he was the first one to grab the knife and go. And I was like, that's awesome. So he really learned a lot. And then peaches, and then one more farmer. So pharmacy was a great experience this year.
Beth, I have a question.
Yeah.
What contributed to the jump from 18 participants to 60?
Well, I honestly think because we had a year under our belt, we kind of knew what to expect, who to recruit. really think that that was it too. We also kind of knew what they wanted to learn, what we
Okay.
needed to cover. We really got provider participation this year. So not only were they hearing us talking about it and being excited, anytime they had a follow-up appointment, their provider was also saying, hey, how's the pharmacy coming? And all that. I also did a lot of phone calls. So
Nice.
kind of to remind them, hey, don't forget this is a 15-week program.
Yeah. Thank you.
Yeah. All right. Another thing that we added in this year was Walk with Ease. We had 2 locations. We did Baker and our Petersburg location. This was our Baker Trail. It's behind our offices and it's just beautiful. It runs right by the river. And oh, the kids just had so much fun. They would come with their parents as well. And luckily, we also got a grant to be able to redo all the trails back there. So they added new gravel, they cleaned it up a lot, and it really made it a nice walk. This is our Petersburg Trail. And then I had to share another shot of the Baker Trail because every week that we went, we saw some sort of wildlife. So this is the turkey. One week we saw a snake, which I'm not a snake fan. So the little boy that is in the other picture, he loved it. And I'm like, oh goodness. But we saw rabbits and deer and squirrels. And so it was just almost like every week we kept saying, what are we going to see this week? But it was really pretty scenery. It was also nice to watch them progress. So we had a small surface or flat surface for the beginning. And then as we progressed, there was a slight hill. And every single one of them was able to complete the last hill by the end of the program. So that was their all big excitement with that trail. We also, with the Walk with Ease, we added an education component for the first half hour of the program. So that's where we would talk about how to use a blood pressure cuff. We had a nurse come in and she demoed, everybody got one that attended the program. She came in and showed them how to use it, what the numbers meant, you know, why it might be high if it wasn't on right. She was very informative and they really enjoyed that. We also had a pharmacist come in and talk about, you know, why they need to take their medications consistently and stay on track with that. And then I also did a lot of diet education. We talked about the DASH diet, the Mediterranean diet. And with that, we brought in some farmers. This is Miriam Leatherman on the top here. She's holding one of, I also work for WIC. And ironically, this is a book written by a fellow WIC worker with me, Mary Beth Lind, but she found recipes in there and we did asparagus and she made asparagus soup and asparagus salad. And all the participants just loved learning and tasting it. The little boy in the picture that like has his cup, like he must have had 3 cups of asparagus soup and the salad. And his mom was just in awe, could not believe that he was eating this asparagus. And we didn't even have to bribe him. He's like, I'll eat that. So that was really neat. But the education part was a lot of fun because they got to ask questions and we also included providers and they could pop in too during that time as well. They also got produce boxes at twice, I think, during the whole entire program. We ended up doing 8 weeks. I know Walk with Ease is 6 weeks, but we had an extra 2 weeks. And they got produce boxes from one of our local farmers, Spring Valley Farms. And we gave them recipes and how to cook with it as well. We also used family nutrition from WVU as well. And also just the extension agent as well from Grant County came up one time and did a little talk on nutrition. So that was fun.
So this was, you sort of turned the Walk with Ease program into like a support group.
Yes.
Yeah, I love
Yeah.
that. That's
Yeah.
great.
And most of these people continued to come to our trail after, even after Vicki and I were not leading the trail or the walk anymore. They still came pretty regularly. So, and they even brought their friends and family and it really was nice. Yeah. They've even asked when I'm going to do it again. I'm like, well, it's almost snow season, so we'll probably wait till the spring again.
Yeah, nice. Thank you.
Okay, so how do we engage our providers? That can be very tricky. The first thing that we did is we got administration support. We have a great CEO, Melissa Thompson. She was very supportive in everything that we wanted to do. So is Charlie Robaugh. He is our COO kind of our special programs. And once we had their support and their excitement, it really just trickled down from there. So I wouldn't say we really did anything like crazy, but we just went with them and talked to them and, you know, told them what we wanted to do, and they were all for it. So that was really nice to have their support. We also have Myra Kessel. She's our operations officer as well. She was very supportive in helping us plan everything out, which was nice because we had to plan out all new schedules and rooms and where we were going to be hosting all this stuff and if we had capacity. So it was really nice to have their support. So once we had their support, it was super easy to get the provider support. Sandy and I actually went to each office and visited one-on-one with each provider. This allowed them to just ask questions as to why we do things or what we were going to be doing. They understood the referral process because sometimes that can be really tricky. They're so busy that they might not have time to check every single box or remember every single program that we're doing. But if we made it easy and streamlined it, that they just had to check a box or send me a message, it was really easy. We're actually in the process of revamping our referral system because we would like to just make it so when they're doing their note, they could just pick it up and push a button and it would refer automatically. So we're working with them on that right now. So hopefully that'll make it even easier. But
I have a question, Beth. What kind
Yeah.
of referral process do you guys use?
So currently we have a paper referral where they just fill it out. So whatever program they want them to attend, they just fill it out and then they fax it to our main office in Petersburg, and that's how we get it.
Okay.
I did have a lot of providers just send me a private message within our EMR system and give me the name, the number, please call this person, they're interested. So that's why we were like, we need to get this into the EMR because we know that they don't have time to actually sit down and fill out paperwork all day long, as much as they want to.
Thank you.
Yeah. We also sat down with all the nurses and care managers as well. We just got the whole care team involved because if the provider doesn't remember all the things that we're doing, maybe their nurse or their care manager would as well. And that seemed to really help too. You know, at each nurse's station, our referrals are actually there. Our paper referrals are there. A flyer about all of our programs that are upcoming are there. So they have it right there. And also I kept a lot of blood pressure monitors in with the care managers. So they would remember, hey, we got these. So that was really helpful as well. This was a big one, but getting our patients to provide personal testimonials to their providers. So from, you know, past DSME participants, we get a lot of great feedback that goes straight back to their provider saying, oh, I learned so much. And last year's pharmacy, I was getting calls after pharmacy ended last year. Providers were calling me, well, why can't we do this all year round? And they just started calling me with questions, but because they heard what their patients enjoyed going to.
So you guys shared their testimonies with the providers. Did you do that word of mouth? Did you just do that by newsletter? How did you do that?
So we have monthly meetings. So we would do that, but most of the time it was our own patients just telling when they had their checkups with their provider, telling them their experiences on it. So that was really helpful too. But we do try to put a plug in during our monthly meetings again of what their patients have said. We also do provide them updates. So if they are coming and they personally referred them in, we try to provide current updates throughout the whole entire class of if they're coming and you know, if they're making any progress towards their personal goals. So that's been very helpful. I would say the personal patient testimonies have been the best referring ways to get our referrals. And I don't bribe them. Okay, So how did we engage our staff? Because not only do we need to get our providers and our medical staff, but everybody has to know what is going on. I wanted to share pictures of 3 of our office managers. We have Kim Hebner on top, Megan Harris, and Diana Orndorff. They are the office managers at the 3 places that we have expanded to currently. They were really great at setting up our schedules. When we met with the providers, they blocked off their schedules for like 5 minutes so that we could get in and talk to them 5 to 15 minutes. They were also, anything we needed, they just were right there to help us get started. So it's really nice when you have their support as well. But they were also able to tell the rest of their staff. So if it was clerical to housekeeping, because you never know who's going to answer the phone or where a phone call might be directed. And you never want to see somebody be told, well, I don't know what you're talking about if they call in about a program. So if the whole office knew what was going on and where, you know, who to even direct the phone call to, that's been very helpful as well. There were several times where, well, this past year, unfortunately, my husband kind of got sick during pharmacy. And if it wasn't for these office managers, I don't know if we would have been able to continue. So they dropped everything that they were doing to run and cover me. And anytime I needed anything, they were right there. So it's really nice to have them. Okay, so our community partners. So I missed a couple on here, so I want to make sure I say them. Farmers Market Association, I forgot them, I'm not really sure. They have been a big help to us, as well as West Virginia Health Connection, wonderful. Our West Virginia Family Nutrition Program has been, Vicki Fertig is our local agent, and oh my goodness, she's just great to work with. The community knows her, so they see her out shopping, they see her out at community events. So when she's part of our programs, you know, they see another community member and they want to be right there. It's also really nice to have somebody, you know, they might get tired of seeing the dietitian, the diabetic educator, you know, we tell them the same things over and over. It's really nice to have someone else that is living it right there, telling them the same things and encouraging them with us. They, you know, they see me being excited about it and then her excited about it, and they just do better. So just having that, I don't, my son always calls it the hype person, but yeah, it's really nice to have that in connection. Grant and Howard EWU extension program. So just our extension agents, Lizzie Matheny and Brooke, she was great to come and help with us with a lot of things. Our health departments, our farmers, Powder Keg Farm was great. Anything we ever needed. Same with Happy Ranch Farm. They were our 2 for pharmacy. We used Buena Vista Farm for our Walk with Ease programs. They provided strawberries actually to everybody. They're a strawberry farm. And they're also the ones who provided all of the asparagus. The Spring Valley Farm too. They provided the produce boxes for the Walk with Ease. And then Mountaineer Food Bank. So they have been a great referral. I got connected with them through another grant, but she has quarterly meetings, which a bunch of community partners get together and talk about food insecurity. So I was able to direct different patients, but then she was able to direct people to our programs and let them know, you know, what we were doing here at EA Hawse beyond what we were doing just with them with the schools and everything. The Mac House is a local kind of like where you can go and donate clothes and food. And that's actually where we donated any extra produce from pharmacy this year. But they were able to also, if somebody's looking for certain services, they're able to refer into our services as well, or any of our providers. And then Unicare this year was a big help in getting people to many of our programs. I got to meet Jonathan Hanna or over the phone, and then Grace Matthews actually came and did a visit. I really feel like they were very instrumental in getting our pharmacy as high as it was too, because not only did they get a lot of their participants to call in and talk to their providers about joining, they also called and did follow-ups to see if they were coming. So I think that was a big help too, to maintain everybody. So it was really nice working with Unicare this year, which was
Hey Beth, we have a question.
Yeah.
Did they provide did they donate, or did they use grant? Did you use grant funds to purchase those? I'm assuming the food boxes. And then the other question was, did you meet once a week?
Yes, we met once a week to do our walking, but they were encouraged to meet multiple times, which most, or 3 times throughout the week, but we only met personally once. And yeah, the grant did help with the food boxes, though we are working to budget that in to our programs because it was such a big hit.
Thank you.
All right. Any other questions about our community partners? I really love working with all these people. It's been fun to, and it's great to get their opinions and what they're hearing from people that they work with too, on what we can do better. So that makes it even more
And how
beneficial.
often do you work with your community partners? Do you guys meet quarterly? Do you guys meet monthly?
Yeah.
Do you make a
So-
strategic plan? Like what are you guys going to do for the next year? That type of thing.
So yeah, so we have a meeting quarterly with the food insecurity. So that kind of gets pretty much most of us all together in one room. So that's been really helpful to do. We haven't really gotten together again to start talking about, working on our get more DSME referrals and show them how to do all that. But we are planning on doing that hopefully within the next couple months to kind of recenter back a little bit. But we do meet quarterly for the food insecurity, which always ends up talking about everything else.
Okay. It's good to have those partnerships for sure and staying engaged with them regularly.
Yeah, it's funny because we all seem to have these same end goals, but sometimes we don't know what everyone else is doing. And there's so many things that you could refer to people to in your community, but if you don't know about them, so it's been really nice to have a central meeting to talk about everything that you could refer to.
Good.
Okay, so we got patients referred. So now what do we do? For the DSME classes, we always make sure that the first class, you're always talking about the format. So with an FQHC, you can only do 1 hour in a day. You can't do 4 hours. So I know some DSME classes, you can do like 4 hours at a time. Unfortunately, you can only meet 1 hour once a day. So some people love to come and they'll come we're only here 3 days a week or at our places. They might come 3 times a week and for their hour and they finish really quickly. And some, because of transportation or work schedules, can only come once a week. So we encourage whatever works in their lifestyle, but we tell them that it is attainable and that we are pretty flexible in what they need to do and meet their goals. We always go over what topics are going to review in class. They're really nervous a lot of times the first time, like we're going to judge them for things and not be supportive or not understand their lifestyles. And I feel like this first class really helps with that and gets them over their jitters. As they continue to come, they do get fun little things. We were able to provide, thanks to the grant, the Bento boxes, cookbooks, Calorie King books. Not everybody has a smartphone that can look up to see how many carbs are in things or calories and fat grams. So it's really nice to have these Calorie King books. We did get the large print as well, which is really nice. And they really enjoy that. We've also been able to provide through EA Hawse 1 CGM if the patient qualifies for it, so they can use it, which is a great teaching tool to see, how different foods affect your blood sugar and, combinations. But the main thing I really think that we help engage and also retain is just meeting where they're at. So, you have the standards of care for DSME or for diabetes. And that's one of the main things that they stress now is just meeting their own personal goals. My goals might not be your goals. Not everyone can shop at, a Kroger or, in Wardensville and Matthias, they might only have a dollar store. So teaching them how to shop what they have available and not making them feel bad about, maybe not being able to get fresh produce every single week because it's just not in their budget or even that they can drive over to get, but telling them that they can still reach their own personal goals and making them feel like they can do has been really big at getting them to keep coming back. And when they see results, that's nice. Okay. And then for the Walk with Ease and the pharmacy, how do we get them to keep coming? Once I get a referral, I immediately personally call each one of them and I discuss the programs that we're doing. So whatever one that they have called in for. Right now, we're actually getting ready to start another diabetes prevention program. So I've been kind of focusing on that. But I do personally call each one, go over what we're going to be doing, let them ask me any questions. We do a one-on-one meeting. So for like 15 minutes, they get to see me in person or whoever else is leading everything. And we obtain their weight, their blood pressure, and other labs, like if we were doing pharmacy labs. That way, you know, they're not just coming to this huge group, walking in for the first time and saying, what is going on here? So that's been really helpful to kind of have that day zero before you start. Of course, providing incentives. So you can see here on the bottom picture, our Calorie King books, our cookbooks that we provided, and that's a bench go box with their portions. Extension was able to provide really nice gifts if you came to pharmacy this year. This is a food processor that somebody got. And then for our walking program, we purchased the water bottles that were nice and steel. So it kept everything cool. So when it got hot, that was really nice. And then Extension provided the cooling towels, which they all like that as well. So it was funny when we first started Walk with Ease in Baker, it was pretty cold, but by the end, it was in the 80s. So they definitely wanted the water bottles and the cooling towels then.
So the food processor, you said one of your participants received that. So did you do a drawing or did you wait till they got midway through to see how did you do that?
So they had to attend, I believe it was out of 15, they had to come to 12 of the programs that they had signed up for, and then they got the gift that they got to choose. So Extension had like a list of things that they could choose from that which was really nice. So it was fun to see what everyone chose. Some people chose knives. This guy chose a food processor, a blender, cutting boards. What else? Somebody wanted a garlic chopper. That's all he wanted out of all the choices. But that was pretty cool. Yeah, an infusion bottle. Some people, they just wanted the infusion bottle. So it was really neat to see what people chose and what they needed. And I thought that was a really good thing. And that was really nice too, because some people would be like, oh my goodness, you know, I have to miss tomorrow. Am I going to be, you know, because it was something out of their control. And we would explain to them, no, that's perfectly fine. We understand 15 weeks is a long time to get to come and to stay engaged. So we're happy if they at least make it to 12. So it was really nice. But we really did have a pretty high, we didn't have too many people drop out, and most people met their 12 at least.
Great.
We did a lot of taste tests. So we did for the Walk with Ease, of course, we did that before we went walking. We made those things and they got to taste it, which I feel if you get to taste it first, that's really helpful. And they will probably try it at home more. And then of course, with the Extension's nutrition program, they did taste testing as well. And our staff here liked it too, because if she had any leftover, I would always see nurses come into the door like, hey, anything to try, and providers. So, okay. And now I have a patient success. So this is Dwayne. Dwayne was funny. He wasn't serious. He loved to just make jokes and have a good time. He attended the DSME classes with Sandy Ford, and he also enrolled into the pharmacy program this year. His starting A1C was greater than 15.5. It was probably maybe 2 weeks before pharmacy ended, and he just barreled through the door here at Grove Street and was like, my A1C is 7.7. He announced it to the whole class. He was just over the moon, so excited. I asked him if I could take his picture, and he said, absolutely. He also had high blood pressure. It is down. He's lost, I think, 30 pounds. I'd have to go back to check. I should have wrote it down. And I said, can I take your picture and share your successes with this group? And he said, absolutely. I'll even come and give him a testimony in person.
That is awesome. Yeah.
Yeah. He really enjoyed our programs. He also, if you weren't there, he was concerned. So he made a lot of friends through this program as well, because he's not an original, I guess, Grant Hardy area person. He moved into our area. So, he was making friends and just, sharing with each other and keeping each other accountable. And I really think that that's what helped a lot. So, but he's doing wonderful. He already asked when the next program is. He definitely wants to do the walking one. He said he wants to continue next year. So he said if he could continue to go to DSME classes, he would. So we'll see how that works out for him. I had some other participants. They wouldn't let me take their pictures. I had one lady, she said I could use her name. Her name is Rietta. She had so much fun. And she was my biggest skeptic when she called. She went to DSME classes and to pharmacy as well. I couldn't get her to go to Walk with Ease, but I think next year I could get her to come. But she was our biggest skeptic. Nothing was going to work for her. She also got her A1C down to, I think it was like 6.3. So she was really excited about that. She learned a lot about cooking. She had so much fun. She has recruited her own friends. And so she lives in Wardensville and her provider is Joe. And she just tells all her friends, well, just call Joe. He'll get you set up and get you started on helping you with your diabetes and get you in these programs. So she's referred people in. She's pretty funny. And then we have Carol. Carol will attend every program we have listed. She is really good about coming, but she also attends the senior center. So our senior centers have kind of been a community partner too, because if she needed to get here, they would drive her over. If she was still at one of their events, would drive her over so she never misses anything. But then she recruits people too from the senior center to come over. And so she's fun. And she attended Walk with Ease, and she continues to walk at least twice a week with one of the friends she made through there as well. And then our provider feedback. So this is Dr. Pufenberger. He's our chief medical director. He actually came, he was working in Baker on those days, and he would actually come to our farmers market, which I think our patients really enjoyed that, to see one of the providers there. That was really nice. He was just a great supporter of all of our programs. He's a great supporter of our diabetes education program. He was excited that we had the blood pressure monitors that we could give to our patients. So it's been really great. I asked him the other day if he would recommend to other facilities, and he was enthusiastically said, absolutely. So, and then, I have multiple other providers that when I delivered the blood pressure monitors, they, within seconds at Hardy County Medical, they were starting a list of all the patients that they wanted to provide them to and who would benefit from what program. And it was really neat to see the excitement with the providers as well. And that is all. Does anybody have any questions?
Good report.
Oh, thanks.
Great.
Thank you.
I participated in the program in Greenberg County. And so there's a lot of similarities. Now, what are the cool towels? Is that just like is that something that they give you, or is it just something they put into water? Or we didn't use those.
So they're very much like the frog togs. I know my son plays baseball and we use those, but you just put them in water and it just makes it really cold. And you can put it around your neck or just to kind of cool you down.
And so you don't need one each time. It's reusable.
It's reusable. Yeah.
Okay.
Yeah. It just washes in the washer and you can put it in the dryer and it's good to go.
And where did you get the water? You had said that you had included the water bottle. Did you purchase those from someplace?
Yes.
And how much
actually, our administrator found them, and I'm not really sure what company she used, to be honest. But yeah, I want to say Quill. I'm not really sure. I'd have to look that up, but I can find that out for you.
And Beth, we have a question in the chat box that says, how often do you offer the 8-week program and how many do you have participate in each session?
Okay, so we were from spring to now, we were offering, I was giving like I was kind of going back from places. So I would do a Baker and then a Petersburg. So we've only offered it twice for the Walk with Ease, once in Baker and once in Petersburg. But we do plan on starting another one again in the spring and then do another one in the summer. And hopefully try to offer them maybe quarterly, trying to do that as long as weather and seeing how that goes. Especially since we do have good participation. In Baker, I feel like we had 6 that came faithfully. And then at Petersburg, we started off with 5 and then it started dwindling. But I think I picked the wrong time of year. We started in the beginning of July. People are on vacation. So just like if somebody was here, then the next person wasn't there the next week because they were on vacation. So if I could do it over again, I think I would do a spring and a fall and try not to do so much in the summer.
Any other questions from anyone? Great presentation, Beth. What was your biggest challenges?
I would say just getting started in general, like figuring out what we really wanted to do was one of our biggest challenges and how we wanted to roll it out. That would probably be our biggest challenge, because I really think that I thought maybe it would be getting our providers on board because they're just so busy and it's just another thing that they have to do. But that wasn't so much of a challenge. Also finding space, that sometimes is a challenge for us. So.
Yeah, I know with, just giving some feedback and in our experiences with other coalitions, sometimes it is that, getting those providers on board is often sometimes a challenge, but one of the key takeaways I've heard is that you call people, you make a personal investment basically, and you just keep knocking on the doors.
Yes, I'm always like
meeting
waiting
with
for someone to
partners.
say, "It's Beth again." Like, stop.
Yeah.
Yeah.
This has been great. I do want to stay on just a few minutes just to see if you guys have any questions or any thoughts. If you guys, have anything you want to comment on.
I have a question. I'm trying to write it in the chat, but I can't do it as quickly as I can ask the question. Did you try to institute like a hydration program where people would on a daily basis try to keep their water level at a certain that was one of the goals that I thought we would institute in our program. And first I went out and got one of these big multi-gallon jugs, which were impossible to carry while you walk, and then we narrowed it down, tried to get free bottles, for the water. But then I do think that it would be good if we could get people, some of those bottles say, oh, you're doing very well, or you're halfway there, it's noon time, but it is on. When you look at that thing, you think, I cannot drink that much water in one day's period of time. And so I just was wondering, have you thought about transitioning that in? How would you go about doing that? Or did you do that?
No, we didn't do that this time. That is a good thing because people do struggle getting their waters. I have one of those bottles that have the hour on there that you're supposed to do it. And it's kind of overwhelming. So I might just, with the bottles that we did provide them, say maybe try to fill it up at least 3 times during the day and see or find out how much they are filling it up. And then every week trying to increase to their personal goals. I might try that something.
Great program.
All right. Well, thank you, Beth. I appreciate you and I appreciate everyone that came on, and we will make the slides available. And we'll also release our recording of this presentation as well. And so it will be on our YouTube page once we've had a chance to get it downloaded and edited and all of that. And then I'll just send everything out in one big wad. So, and if you want to get a hold of Beth and talk to her, I'll share her email address with you guys too, as well in the information that we'll provide back to you guys. So great information, great opportunity just to sit here and chat with you and learn about all the great things that you guys are doing, and keep up the good work.
Thanks. It's been fun. I'm
Great.
glad we've had the opportunity.
Appreciate you very, very much. Appreciate everyone that tuned in today.
Thank you.
All right. Thanks, everyone.
I hope they're just finishing.